Catherine Muma. Senator for Nairobi City County, informed through a letter that you've been nominated to ask that question.
Indeed, Speaker, I have. Speaker, in this conversation, for as long as you hear people saying SHA is working, but there's always going to be a problem, and these questions by Senator Catherine Muma are pointers that there are issues still, and we must keep asking these questions despite all the backpatting that we've seen from some of my colleagues. This is the question by nominated Senator Catherine Muma to the Cabinet Secretary for Health. Number 31A. Honorable Speaker, what is the rationale for the 18-year age restriction in access to hearing aids under the Social Health Insurance Assistive Devices Benefit Package? B, when will the discriminatory age restriction be removed so as to allow adults with hearing impairments to access hearing aids under the SHA Assistive Devices Benefit Package? C, what is the ministry doing to address the high cost of hearing aids in Kenya? And could the Cabinet Secretary state whether there are plans to procure and distribute hearing aids through the Kenya Medical Supplies Authority or other government procurement channels to make them affordable? And lastly, Honorable Speaker, could the Cabinet Secretary outline the long-term strategies in place to enhance access to quality health care by persons with hearing impairments and provide details on government's plans to train and recruit additional audiologists, establish hearing care centers in every county, and integrate ear and hearing care into primary health services to facilitate early screening, among other interventions? Thank you, Honorable Speaker.
Honorable CS, you may respond.
Honorable Speaker, the temporary 18-year age restriction on access to hearing aids is not intended to be exclusionary, but rather serve as an interim core containment measures driven by the current resource constraint within the scheme. I say this because the prioritization of individuals up to 18 years was strictly informed by the critical importance of hearing in speech, cognitive development, and educational attainment during formative years. So it also factors in the long-term socio-economic impact of early intervention, aiming to minimize the clinical outcomes within the limited physical space. On question B, Honorable Speaker and members, this restriction is not permanent. SHA, working with the Ministry of Health, we are currently undertaking a very continuous actuarial assessment to evaluate the affordability alongside resource mobilization and benefits within the scheme. So we are working on a very progressive benefit expansion to include adults, and this will be planned and it will be implemented soon. But this is a function of the expansion of benefits for this age category will be guided by a body that is in law called Benefit Package and Tariff Advisory Panel, which must submit a report by September, which is mandated to review and advise on benefit design, the cost effectiveness, and how do we prioritize. So we have written, SHA ourselves, we have written to, is part of the things we have told the whole, a whole set of issues to be reviewed and for them to advise us on benefit design and the cost effectiveness. So this one is with that committee, and I'm sure they will make the right decision for the benefit of Kenyans who are in this category. What are we doing as a ministry to address the high cost of hearing aids? I agree that we recognize the high cost of hearing aids remains a very critical barrier, and it's very, not only in Kenya, in many of our African countries. It has become a barrier. It has become a barrier in terms of access. Hearing aids typically cost between 40,000 to 150,000. With most devices, again, are imported on a very small scale. They are sold through private outlets. at prices which are unaffordable to the majority of our citizens. These challenges, Honorable Speaker, again is compounded by the limited audiology services outside the major urban centers. So the people who are suffering more are our Kenyans who are in the rural areas. Then again, as the Senator for Nairobi, on behalf of Senator Muma, has raised, we have a very serious shortage of trained specialists as a country. And we heavily, again, there's a heavy reliance on out-of-pocket payments. So the people at the bottom of the economic ladder suffer. And it also affects the whole concept of universal health coverage. So it brings the issue of inadequate access, particularly in rural counties. This again is further aggravated by the fragmentation taxation. There is an element of tax. While the VAT cap 47 accords preferential treatment to complete hearing, and I remember when I was the National Assembly, we removed that. But it was not done in a very structured way. Some aspect of it, of these hearing aids have been removed, are still holding some taxes as ordinary parts. So all these costs put together are passed to the user. So we need to address a whole ecosystem, a whole area where we feel ultimately we should reduce the cost. We are working with suppliers and importers and vendors, Honorable Speaker. Good example is, I said last time, we have reduced the cost of breast cancer, the drug that is used for breast cancer, from 120,000 to about 40,000. We are talking to other big pharma companies. Have an MOU with them, because the cost of care, cost of drugs in our country is very high. But we have standardized specification for basic, mid-range, and advanced hearing aids in Kenya, assistive technology specification list, which will be incorporated into the Kenya Essential Medical List, which will allow us, this specification will be used to aggregate the national demand under the Social Health Insurance Fund, so that we see whether, leveraging on the economies of scale, we can use KEMSA to go and buy in bulk, pool procurement, and then talk to manufacturers and lower the prices. So it's something that we at the Ministry of Health are tackling, and I'm very happy the Honorable Senator has raised. But through the 80 Scale Initiative, which we are working with the Clinton Health Access Initiative, we are now procuring over 2,000 hearing aids for distribution to all our public health facilities and hospitals. And why is this? We are building on a very initial phase that has already equipped 27 facilities with the screening and diagnostic tools across multiple counties. So, Honorable Speaker, I have instructed KEMSA that hearing assertive technologies be now integrated into the National Logistic Management Information System, must be integrated into our Kenya Medicine list that KEMSA and MOH has, and then we increase the screening and the diagnostic tools across multiple counties. Finally, the Ministry of Health, Honorable Speaker, will engage the National Treasury this year during the finance bill to propose amendments aligning the tax treatment of all hearing aids components, including essential parts, accessories, and consumables, are aligned and they are tax-free. This will help us ensure indispensable components of hearing aids are treated as integral medical device for persons with disability, rather than ordinary taxable spare parts, thereby reducing the out-of-pocket cost and advancing universal health coverage for persons. So we want to make sure that once that tax is removed, they can be financed and paid for under the Social Health Authority tariff. But the National Council for Persons with Disability has already initiated a framework agreement to strengthen the public procurement pathways of the whole country in terms of hearing assistive devices. Honorable Speaker. Honorable Speaker, what are our long-term strategies in place to enhance access to quality health care by persons with this condition, with hearing impairments? The ministry is implementing the National Ear and Hearing Care Strategic Plan 2023-2028. This is a very comprehensive framework and is designed to expand both ear and hearing services across all levels of care in our health ecosystem. And this plan helps to establish hearing clinics in all the sub-counties and integrate prevention, screening, and treatment into the primary healthcare services under UHC. So to strengthen the workforce, our community health promoters, our maternal and child health nurses are being trained both at our middle level colleges, at our universities. They will be trained in prevention, in early detection, and in referral. Concurrently, the University of Nairobi and KMTC and the Kenya Institute of Special Education are also scaling up how they can produce more audiologists and more speech, language, and therapists. Honorable Speaker, when I saw this question, I had to talk to the DG who is here. And I can confirm that as a country, we have serious shortage of specialists, even speech therapy. Even when we put the cochlear implant into our children at tender age, they recover very easy to hear. But the biggest problem is they recover and they take long on the speech therapy. So it's something we have seen, and I think we will talk to our training institutions and more Kenyans and to bring the curriculum and work through. Thank you, Honorable Speaker.
Senator Sifuna, do you have any supplementary question?
Indeed, Speaker, I do. Unfortunately for me, the ODM expert on PWDs is not in the House today, Senator Crystal Asige. But I do, if my memory serves right, we did pass as a House an amendment, Honorable Speaker, and I thought we touched on this question of taxation of assistive devices. It just doesn't make any sense why a government would impose VAT on essential components such as hearing aids. But I want to assure the Minister that we'll be following up when that tax conversation comes up to see that this government actually does away with taxation on those essential hearing aids. But since the CS has pegged down the capping of receipt of these assistive devices to 18 years to the cost of the product, and if you look at the response, it's saying that it is a cost containment measure driven by current resource constraints. Does the CS or the ministry have empirical numbers? How many people above the age of 18 in the country, or what percentage of the population is actually in need of these things, so that we actually know that it is a heavy cost to government and you're not just telling us stories? Because you've told us here you are undertaking actuarial assessments, which I believe must be based on data and numbers. Do you have those numbers, Waziri, on how many people above the age of 18 in Kenya require these assistive devices? I thank you, Honorable Speaker.
Senator Dulu.
Thank you, Mr. Speaker.